Minnesota is currently home to many individuals who come from other countries. These are new Americans who have come to experience the American dream, partly because they come from countries where they have got political issues and they want a place where their families can grow and thrive. And others have just decided to say, okay, I think I want to be part of the American dream, and they have come here and they want to stay in Minnesota. And part of these people, we've got individuals who are trained as physicians from their countries of origin, and they would like to practice medicine in the United States. What we are finding is that the process of becoming physicians in Minnesota particularly is really a challenge to many individuals.
This is a really exciting opportunity for me to talk about the great assets we have in Minnesota. In 2005, we did a needs assessment, and I worked with 25 doctors and nurses. They were working as taxi drivers, parking attendants, and nursing assistants, and they all wanted to get their license.
Yeah, the new Americans in Minnesota, and particularly those who are in our program and are trained as physicians from other countries, are a resource to this community, and they can help fill the physician shortage that we are experiencing in Minnesota, especially in the rural areas and underserved areas. And being a resource, we really need to invest in them, and the investment we are going to make may not be so much because they are already trained from other countries where they're coming from.
And now we find that with the availability of scholarships, doctors are actually passing the exams and are getting ready to go into residency.
The state legislature has been very supportive to our program for foreign trained physicians. We have the Department of Health, which is very supportive. The university has also come along, and many other individuals. And we would like to encourage this kind of partnership to continue.
However, we still have the barrier of people not getting into residency. This year we have 24 doctors that have finished all the exams and are trying to get into residency. And it's such a waste because these doctors right now, they are working as phlebotomists. One of them working as just in a factory. Some of them are working in factories. Some of them are working as technicians. A few of them are working as research analysts, but only a few. And so if Minnesota could just have a program that removed the barriers to get into medical residency, you will be able to have over 100 doctors from different countries all over the world integrated in the Minnesota healthcare systems. Imagine we have over 40 countries represented among our database of 200 doctors, and they speak multiple languages. If these doctors are integrated in the healthcare system, they will be able to provide culturally and linguistically appropriate healthcare services. So we know that if we have doctors that speak multiple languages and understand the culture of the diverse population we have, we will attract people to come to the clinic for primary care, and as a result, they will use less emergency care as they're using now. That will in turn decrease the cost of health services, and you have cost savings. In addition, you will decrease health disparities.